$20 as the night shift princess quits by Friday. That is what Dr. Caldwell said 48 hours before a 4-star general's life would depend on the woman he just humiliated. Sarah Chen moved through Cedar Creek Medical's night corridors in Savannah with the kind of precision that comes from having already survived the worst the world can offer. Her scrubs were crisp despite the humidity that pressed against the hospital's glass doors like something alive, waiting. The fluorescent lights caught the faint scar tissue on her forearms as she checked for lines in the cardiac ICU, burns that no community college nursing program would explain, marks that belonged to a different life entirely. She kept a tarnished challenge coin in her scrub pocket, the edges worn smooth from 7 years of fingers finding it during quiet moments. The coin had been pressed into her palm in a hospital courtyard in Baghdad in 2019, given by a man whose name she would never be allowed to speak again. That was the year she had stopped being herself, the year she had become something else entirely, a ghost in civilian scrubs, assigned to Cedar Creek Medical with a fabricated work history and a 2-year mission that was eating away at her like rust. The night shift suited her. Fewer people. Fewer questions. Fewer chances for someone to recognize the way she moved, the way her hands knew exactly where to go before her brain told them. The way she could assess a dying patient in less than 3 seconds and know exactly what needed to happen next. In bed 3 of the cardiac ICU, a retired Special Forces combat medic named Raymond Clayton was recovering from a quadruple bypass surgery. His name tag said retired. His eyes said he had never actually stopped being what he was. He watched everything. He watched the nurses. He watched the monitors. He watched her. Sarah was adjusting his chest tube dressing at 2:37 a.m. when she felt his gaze lock onto her hands. The dressing needed to be secured at a precise angle to prevent tension pneumothorax, so she performed the needle driver technique, a particular way of handling the suture that came from a specific training program, the kind of program that didn't advertise itself and didn't exist in any civilian hospital database. The technique was efficient. It was perfect. It was unmistakably military. Clayton's breathing changed. Not from pain. From recognition. She didn't look at him. She continued her work with the same meticulous precision, each movement economical, nothing wasted. The fluorescent light above his bed buzzed like an insect trapped in plastic, and she heard him shift his weight slightly, testing his incision, assessing his own pain the way combat medics do, cataloging data, not complaining about sensation. When she finished securing the dressing and stepped back, she felt him studying her profile. She kept her eyes on the monitor. Heart rate steady. O2 sat at 94%. Blood pressure stable at 118/74. Baghdad General Hospital, he whispered. Not a question. A statement. 2019. Her jaw tightened. Imperceptibly. The kind of tightening that only happens when someone has been trained to control every physical response, when trembling and breathing changes and voice cracks are luxuries that can get people killed. She didn't turn toward him. She didn't acknowledge the words. She simply finished her charting on the monitor screen and moved to the next patient's room, her footsteps steady on the tile floor. The challenge coin in her pocket felt heavier. Dr. Caldwell had watched her for exactly 3 days before making his move. He was the hospital's cardiac chief, which meant he had power and he knew how to use it. He had also built a second career on billing codes that didn't exist and kickbacks from medical device suppliers who understood that inflated surgical numbers meant inflated commissions. Sarah's chart reviews were too meticulous. She noticed patterns. She asked questions about discrepancies that didn't match clinical realities. She was the kind of nurse who read the bills the way combat soldiers read terrain, looking for what didn't belong, what didn't make sense, what was hiding in plain sight. So on Friday morning, Caldwell sat at the attending physician's table in the hospital cafeteria and announced his intentions to a room full of colleagues who laughed because he was the department chief and his laughter set the tone for everyone else. $20 as the night shift princess quits by Friday, he said, loud enough for the surrounding tables to hear. He was gesturing toward Sarah, who was standing in line at the salad bar. She wasn't reacting. She was loading her plate with grilled chicken and vegetables, her movements precise, her face showing nothing. "She's been here 3 days and she's already acting like she knows how to do my job. Give her a week of mandatory overtime and watching real surgeons work, and she'll realize what she's actually qualified for. $20, gentlemen. Anyone taking that bet?" Several doctors laughed. The bet was accepted by a cardiologist named Pierce, who apparently believed Sarah would make it to Friday and a half. The words hung in the cafeteria air like cigarette smoke from a previous decade, drifting over tables where people were trying to eat breakfast before their surgical schedules consumed the next 12 hours. Sarah carried her plate to a corner table and sat with her back against the wall. This was habit. This was Baghdad. This was everywhere she'd ever had to be. Caldwell watched her not react. This bothered him more than if she had thrown her plate. He was accustomed to women responding to his attention either with smiles or with anger, either with flirtation or with complaints to HR. Sarah Chen simply sat down and ate her chicken and read something on her phone that made her expression not change at all. He decided to escalate. At 12:18 p.m., as Sarah was getting her lunch from the cafeteria line on day 4, Caldwell was 3 people behind her, close enough to be deliberate about it. She had picked up a tray. Grilled chicken again. Brown rice. Steamed broccoli. A cup of black coffee. The same meal she'd eaten since arriving at Cedar Creek Medical, the same careful attention to fuel that a soldier maintains in a combat zone, calories and hydration, and nothing that would slow reaction time. Caldwell reached out and knocked the tray from her hands. It wasn't clumsy. It wasn't accidental. It was a precise strike with the back of his wrist that sent the tray spinning through the air, the coffee cup shattering against the tile floor like a small explosion of ceramic and hot liquid, the plate of chicken and rice scattering across the floor in pieces that looked like an accident, like a moment of weakness. The cafeteria went quiet. Not dead silent, there was still the hum of fluorescent lights overhead, the distant sound of kitchen equipment, the ambient noise of 60 people suddenly holding their breath. But the conversation stopped. The forks paused. The room was watching. Caldwell was smiling. The smile of a man who had never faced consequences in his life. "Clumsy," he said. "You know, they have training programs for that kind of thing." Sarah didn't hesitate. She didn't reach out to stop the tray. She didn't gasp or move to catch what was falling. She simply watched it happen and then looked at the mess on the floor. Then she looked at Caldwell. Not with anger. With the kind of calm that comes from having already made the decision that this man's opinion was irrelevant, that his power was temporary, that his moment was already ending even though he didn't know it yet. "I'll clean that up," she said. Quiet. Steady. Maximum 10 words. But she didn't move yet. She stood there for exactly 3 seconds, long enough for Caldwell to realize she wasn't embarrassed, that she wasn't crying, that she wasn't leaving. She was simply calculating. Her eyes moved across his face like she was reading text written in a language only she could decipher. Then she bent down and began collecting the pieces. Caldwell stood over her as she knelt on the tile floor, picking up broken ceramic and scattered rice and chicken pieces, her hands moving with the same precision she used for everything else. He was waiting for something, a tremor in her hands, a flush in her cheeks, a crack in her voice when she spoke. But there was nothing. Her hands were steady as surgical instruments. Her face remained blank. When she picked up the largest piece of ceramic, she held it like evidence, not like garbage. "Maybe," Caldwell said, loud enough for the cafeteria to hear, "they taught you to fetch in whatever community college you crawled out of." The laughter was quieter this time. Some of the younger residents weren't laughing at all. They were watching Sarah, and something in her composure was making them uncomfortable, the way prey animals become uncomfortable when they realize the thing they thought was prey is actually apex something else. She picked up the last piece of rice and stood up. She didn't address Caldwell. She didn't say anything at all. She walked to the trash bin and disposed of the pieces with the same careful deliberation she used for everything, then she got paper towels and cleaned the floor of any remaining rice and coffee residue. The whole process took 4 minutes and 17 seconds. Caldwell had moved away by the time she was done. The challenge coin in her pocket felt like a heartbeat. At 3:56 p.m., Sarah was assisting with a chest tube insertion on a trauma patient in the psych when Clayton's wife appeared in the doorway, looking for her husband's nurse. Sarah was holding a retractor steady while the surgical resident prepared the site with betadine and sterile technique, and her hands weren't moving because they were locked in position, but her eyes tracked the woman's presence and then she returned her focus to the surgery. The resident, a young doctor named Mitchell, maybe 28 years old, was struggling with the angle. The needle should have been going in at the 5th intercostal space, anterior axillary line, but his hands were shaking slightly and the entry point was off by a centimeter. Sarah saw it the way other people saw colors. She saw it and she knew exactly how to correct it without saying a word, so she adjusted the angle of her retraction by 3 millimeters, which shifted his visual field and his muscle memory took over, and suddenly the needle was going in at precisely the right angle, the hiss of air escaping from the pleural space like a small sigh of relief. Mitchell didn't realize she had done that. Most people never realized when Sarah had done anything at all. That was part of her training. That was part of being invisible. But Clayton had recognized the needle driver technique in her sutures, the way her hands positioned themselves for the insertion, the economy of movement that came from muscle memory developed over 100 field surgeries in places with names that didn't appear on most maps. When she finally left the psychu at 5:12 a.m., after her shift had ended, she found Clayton waiting by the elevators. His discharge paperwork was in his hands. He was leaving this morning. His wife had driven in from Jacksonville and they were heading back home in a Silverado pickup truck that was probably older than Sarah's entire career in uniform. He waited until they were alone in the elevator before he spoke. "I never got your name," he said. "Sarah Chen." She said it flatly. The name she had been assigned. The name that wasn't hers. "No, you didn't." He said it like a fact he'd already verified. "But I know where you got that technique. And I know what it means when a combat medic can still hold steady on a third insertion after 3 years away from active service." He paused. The elevator was descending. Floor 7. Floor 6. "You ever need backup, you call Clayton. First name Raymond. I'm still connected, and I still remember how to suit up." Sarah didn't look at him. She was looking at the floor numbers descending. "I'm just a nurse." "No," Clayton said. "You're not." The elevator doors opened on the ground floor and he stepped out without waiting for her to respond. Sarah stood alone in the metal box as the doors closed again, her hand moving to the challenge coin in her pocket, her fingers finding the familiar worn edges, and she understood in that moment that her cover had been compromised. Someone knew. Not everything. But enough. The challenge coin felt like it was burning. The pre-op notes felt light in Sarah's hands as she approached the nurse's station, clipboard balanced with the kind of precision that came from years of field medicine where a dropped report could cost lives. 3 pages, complete vitals, labs cross-referenced, supply inventory verified. The valve replacement scheduled for 0800 hours required flawless documentation. She'd spent the previous shift triple-checking every detail because details were how you kept people alive and how you caught people stealing. Dr. Caldwell sat at the station reviewing imaging films, his surgeon's hands resting on the keyboard like he owned the space itself. His Rolex caught the fluorescent light, $17,000, Sarah had noted, the watch of a man who'd found ways to make cardiac surgery extremely profitable. She approached from his left, placed the notes on the desk in front of him, and waited. He flipped through the pages. Once. Twice. His jaw tightened at something on page 2. Then his face shifted into the expression of a man who decided what came next would hurt. The clipboard sailed from his hands and clattered across the tile floor, metal ringing against ceramic like a struck bell. It skidded 3 feet, stopping at Sarah's feet. The sound echoed through the ICU corridor. Phone stopped ringing. Conversations paused. Every eye in the nurse's station turned. "Pick that up, sweetheart," Caldwell said, voice carrying the surgical precision of someone accustomed to absolute obedience. Maybe they taught you to fetch in whatever community college you crawled out of, but here at Cedar Creek we expect complete documentation. All of it. Not your best guess. The other nurses wouldn't look at her. The resident studying the vital sign monitor suddenly became very focused on the screen. A respiratory tech found urgent business with her oxygen tubing. Sarah bent from the waist, retrieved the clipboard, and returned to her station 3 feet away. Her knuckles whitened once on her pen. Just once. Then the color returned. She continued her charting, each notation precise and controlled, her handwriting not trembling though Caldwell's voice had been designed to make it do exactly that. The fluorescent lights buzzed overhead like angry insects. Around her, the ICU resumed its rhythms, ventilators wheezing, monitors beeping their electronic pulse, the distant code blue announcement from another ward. She did not glance at Caldwell. She did not acknowledge the humiliation with so much as a breath pattern change. She simply worked, because that was what Master Chief Petty Officers did when they were undercover as night shift nurses in Savannah hospitals. They absorbed damage and continued the mission. What Caldwell didn't understand was that her meticulous charting wasn't nervousness or excessive caution. It was a hunter's documentation. A tracker's attention to detail. 2 days earlier, she'd noticed the first inconsistency. The valve replacement on Tuesday had been coded as a complex revision with 4 hours of operative time, but the actual procedure notes from the OR staff documented 93 minutes. The billing spread was $638. She'd flagged it mentally and kept watching. On Wednesday, the device supplier, Artisan Cardiac Solutions out of Boston, had billed for a rotating rack of mitral valve prosthetics, quantity 4, but only one prosthetic had been documented in the operative notes. The others had been itemized as backup inventory, non-billable. Except they'd been billed anyway. $23,000 for 3 prosthetics that hadn't left their packaging. Sarah had been trained to see patterns. It was how you spotted IED emplacements from a convoy. How you identified who in a compound was military and who was civilian. How you survived. The patterns in Caldwell's billing were as obvious as hand grenades stacked beside a doorway. He'd begun to notice her notice them. The cafeteria incident on day 2 had come after she'd spent the previous shift auditing 6 months of his surgical records. The clipboard throw on day 4 had happened immediately after she'd documented a discrepancy in the medical device supplier kickback arrangement, Caldwell taking a percentage of every Artisan sale, paid to a shell company registered to his wife's maiden name. The sweetheart comments and public mockery had escalated precisely as her chart reviews had become more thorough and her documentation more damning. He was testing her. Seeing if he could crack her open, make her emotional, provoke her into either quitting or making a mistake that would discredit her work. The betting pool, $20 as the night shift princess quits by Friday, had been his initial strategy. Make it social humiliation, make it a game, make it sound like she was too fragile for real nursing. When that hadn't worked, he'd escalated. The Thursday night shift, she'd been assisting with a chest tube insertion on the patient in bed 3, the retired Special Forces combat medic, the one who'd recognized her Baghdad technique. Caldwell had positioned himself in the doorway and announced to the attending physician, "Did Princess here even pass basic anatomy? She's holding that needle driver like she's knitting." His voice had been loud enough for the patient to hear. Loud enough for the nursing students shadowing in the unit to hear. Loud enough to plant doubt about her competence in every listener's mind. Sarah had kept her hand steady on the needle driver, a curved clamp designed for precise tissue manipulation, and had completed the chest tube insertion with the kind of clean, efficient motion that came from doing the procedure 47 times in field hospitals where you didn't get a second chance. The monitor showed immediate lung expansion. The patient's oxygen saturation climbed from 87 to 94%. The retired Special Forces medic had caught her eye as she passed his room later that evening and had whispered something that made her muscle memory stutter for half a heartbeat, Baghdad General Hospital, 2019. She hadn't answered. Hadn't broken stride. Hadn't given any sign she'd heard him. But her hand had found the tarnished challenge coin in her pocket, the one the combat medic had probably carried himself, the the one she'd kept pressed against her ribs for 2 years as her only connection to the identity the Navy had told her to bury. Caldwell had missed the exchange entirely, but something in her charts was keeping him awake at night. She could see it in the way his jaw clenched when she passed, the way he'd started making phone calls in his office with the door closed, the way he'd scheduled an emergency finance review with the hospital board for Friday afternoon. She documented everything. 17 instances of billing inflation. $42,000 in device charges for inventory never used. Kickback arrangements in plain language in the supplier contracts she'd photographed from Caldwell's desk drawer during the night shift. The pattern so clear that the state medical board investigator would need maybe 3 hours to build a criminal case. The problem was that she wasn't supposed to care. Her orders were intelligence gathering only. Documentation. Maintain cover. Get the evidence and extract. The fraud was incidental to her mission. What mattered was identifying the network of people and institutions that protected financial criminals. But she did care. She cared because she'd sworn an oath, and because Caldwell was stealing from patients too sick to check their bills, and because the combat medic in bed 3 had recognized something in her that wasn't supposed to exist anymore. Friday afternoon at 0200 hours, the monitors erupted. The 4-star general in the CCU bed, the one who'd been admitted with crushing chest pain, the one whose bearing suggested command even through morphine, his cardiac rhythm degenerated into something that wasn't rhythmic anymore. Something was tearing itself open inside his chest. Sarah watched as Caldwell called it in. Watched as exactly 10 doctors arrived within minutes, flooding the ICU like a response team to a siege. 3 cardiac surgeons under Caldwell's direction. 2 thoracic specialists from the surgical wing. 3 consulting cardiologists from the network. 1 attending anesthesiologist. 1 vascular surgeon. 10. All of them brilliant. All of them competent. All of them walking out of the ICU within 1 hour, refusing the case. Inoperable, the first one had said, not looking at the patient's face. Too high risk, the second one had echoed, already thinking about the next patient, the one who could survive. He won't make it off bypass, the thoracic chief had stated with the certainty of someone who'd done this calculation 100 times before. Caldwell made the final call, make him comfortable. Palliative care only. They filed out. The ICU doors closed behind them. Sarah watched the general's pressure dropping on the monitor, watched his tissue perfusion failing in real time, watched the combat medic in bed 3 mouth something that looked like an order. Her orders were intelligence gathering. But the combat medic had recognized her, and the general had military bearing, and 10 doctors had just decided that someone with the command presence of a 4-star Special Forces officer wasn't worth saving. Sarah found her hands moving before her mind caught up to the implications. She was drawing up a syringe. She was approaching the general's bedside. She was finding the challenge coin in her pocket, letting the cold metal ground her for exactly half a second, and then the military part of her brain, the part that had survived Baghdad, that knew how to save lives in places where saving lives was nearly impossible, took over completely. The other nurses didn't try to stop her. The 0200 hours admission came through the ER like a seismic shock. 4-star General Marcus Reeves, 73 years old, crushing substernal chest pain radiating into his back, blood pressure bottoming out at 82/51, oxygen saturation dropping like a stone. The CT scan took 17 minutes. Aortic dissection. Not a type B that might be managed medically. Type A, the kind that kills you in the elevator if you're unlucky. Sarah watched the monitors from her assigned station at the head of Reeves' bed in the cardiac ICU, the ventilator already pushing oxygen into his failing lungs, 2 central lines running wide open, the heart rhythm on the screen a chaotic electrical storm that looked less like life and more like a building burning down from the inside. His pupils were reactive. His brain was still getting blood. For now. That mattered. Everything else was borrowed time. She didn't know who he was. Not yet. The chart just said the name, the age, the diagnosis. She knew the numbers that mattered, blood pressure trending down, lactate climbing toward 4, the dissection extending into his descending thoracic aorta on the images. She'd seen this pattern before. In Baghdad. In field hospitals where the surgeons were exhausted and the supplies never came and you held people together with your hands because that's all you had. She pulled the bedside monitor closer and watched the clock. The first doctor arrived at 0217. Then another. Then 3 more crowding the doorway, their faces moving through a rapid sequence of expressions, initial concern, then assessment, then the subtle shift that came when they realized what they were looking at. Not a problem. A catastrophe. Dr. Caldwell pushed through the cluster of residents at 0224, still wearing his expensive wool coat, his presence radiating the kind of arrogance that filled rooms the way smoke fills hallways. He studied the films on the computer station for exactly 90 seconds, his jaw tightening almost imperceptibly. Type A with descending extension. His voice was flat, clinical, the tone of someone who'd already made a decision and was simply waiting for his mouth to catch up. His age. The extent of the dissection. The vital organ involvement. There's nothing we can do. Sarah heard him. Didn't respond. Didn't look up from the monitor where reeved oxygen saturation was hovering at 88% and needed to stay above 90. She'd learned long ago that doctors didn't listen to nurses anyway. She was furniture. Competent furniture, but furniture nonetheless. A cardiothoracic specialist named Harrison arrived 15 minutes later, summoned from home according to the pages Sarah had watched Caldwell send. He reviewed the films in silence, his hands jammed into his pockets, his shoulders tensing as he processed what the imaging showed. Ascending aorta involvement? Pericardial effusion. He looked at Caldwell like a man looking at the ocean before a hurricane. What's your recommendation? He needs medical management only. Caldwell's voice had the texture of finished concrete. He's 73. The risk of surgery at his age with this extent of dissection exceeds any benefit. We manage his blood pressure, keep him comfortable, and allow nature to take its course. The second cardiothoracic consultant arrived at 0244, then a third. Sarah counted them the way soldiers count ammunition, not because she was optimistic, but because counting helped her focus. 3 physicians now standing around a bed of a man whose heart was being torn apart from the inside, and all 3 had the same expression. The expression of people who'd already written the ending and were simply waiting for the patient to catch up to their narrative. By 0256, 10 doctors had cycled through the ICU. Caldwell's entire surgical team, 5 attendings and 2 senior residents. 3 consulting cardiologists pulled from their beds. 2 thoracic specialists from other institutions, their expertise worth thousands of dollars per hour, now worthless because the decision had already been made. Sarah watched each one examine Reeves, review the scans, exchange glances with the others. She watched the almost mathematical precision of their refusal, like a coordinated retreat from a battle that hadn't even been joined. Inoperable, the first cardiothoracic surgeon said. Beyond our scope, the second one replied. Comfort care measures, offered the consulting cardiologist from Savannah General, his tone the gentle voice of someone recommending surrender. Within a single hour, from 0217 to 0318, all 10 had rendered the same verdict. No surgery. No intervention. No attempt. The general's aorta was shredding itself apart, and the 10 smartest physicians in 3 hospitals had collectively decided that letting him die was more professional than trying to save him. At 0319, Caldwell and his team walked out of the ICU. Not quickly. Not with visible frustration. Just a coordinated, almost choreographed exit of people who'd solved the equation and found the answer unsatisfactory but inevitable. Sarah watched them leave. Watched the doors close. Watched the monitor where General Reeves' blood pressure had dropped to 71/43 and the lactate was climbing toward 5.2 and the heart rhythm was becoming increasingly chaotic, less coordinated, the electrical signals spreading out like ripples that couldn't agree on which direction to travel. His pupils were still reactive. Still there. Still fighting. She pulled the crash cart to the bedside. Not the small one. The full unit, the kind designed for circumstances where you were about to do something beyond the scope of every credentialing board and institutional protocol. The retractor. The chest spreaders. The surgical instruments laid out like a surgeon's dream because Sarah had learned to prepare for certain situations, because her hands remembered things her name couldn't speak. The monitors showed his heart rate climbing above 160, the oxygen saturation dropping below 85 despite the ventilator pushing maximum oxygen into his lungs. You didn't need a medical degree to read that story. The general was dying. The 10 doctors had decided his death was acceptable. Cedar Creek Medical would have a quality assurance review in 3 months about the case they declined to take. Everyone would agree it was the right call. The institutional liability was too high. The chance of success too low. The general would be dead, and nobody would remember his name except his family and the people who loved him. Sarah found the challenge coin in her scrub pocket and let the cold metal ground her for exactly half a second. Then the military part of her brain, the part that had survived Baghdad, that knew how to save lives in places where saving lives was nearly impossible, took over completely. She didn't ask permission. She didn't call another physician. She positioned the crash cart at the head of the bed and found the space on his chest where she'd learned to work 15 years ago, in field hospitals where the electricity ran on generators and the surgery was done with a flashlight and prayer. She prepped the skin with betadine in one swift motion, the acrid smell of antiseptic filling the immediate air around the general's chest like a chemical promise of violence. The scalpel was sharp. She made the incision laterally across his left anterior chest wall, cutting through skin and subcutaneous tissue with the kind of precision that came from having done this in trucks bouncing across the sunny triangle while rounds were going through the vehicle's armor plating. The bleeding was minimal because his blood pressure was so low the vessels barely wept. She spread the ribs with the retractor, feeling the mechanical resistance of bone against metal, the sternum pushing back against her strength and then yielding, the space inside his chest opening like an aperture widening. His heart was there. Visible. Beating in that chaotic rhythm, the muscles' fibers quivering instead of contracting, the valve structures straining against the dissection that was tearing them apart. She positioned her hands, one on top, one underneath, and began direct cardiac massage, compressing the ventricles with the rhythm that 15 years ago in Baghdad had been the only thing standing between a man and eternity. Compress. Release. Compress. Release. Not gentle. Not cautious. The kind of aggressive compression that broke ribs and cracked sternums and saved lives because hesitation killed faster than any disease. Phantom. The voice came from Bed 3, the retired Special Forces medic who'd been recovering from his own surgery, who recognized the technique because he'd trained the same way, in the same wars, with the same people who understood that sometimes the only way to save someone was to break them open. The door opened at 0321. Dr. Caldwell froze in the threshold, the medical record chart still clutched in his hand, his face cycling through shock to disbelief to something darker, the expression of a man watching someone cross a line he'd established and watching that line dissolve like it had never existed. Sarah's wrist was deep inside General Reeves' thoracic cavity. Her hands were compressing his heart with perfect rhythm. Her face was focused with the kind of concentration that Caldwell had never seen before, the kind that made it clear she wasn't a nurse anymore. She was something else. Something that had been hiding inside the quiet night shift worker who accepted his insults without flinching, who retrieved his clipboards without protest, who worked as if she understood her place. The monitors behind her showed oxygen climbing. 72, 79. 84, the lactate would be dropping. The perfusion to Reeves' brain and kidneys and heart was being maintained by the pressure of her hands, by the decision she'd made at the moment when 10 better-credentialed people had walked away. Caldwell's expression shifted. Not to concern for the patient. To calculation. To rage. To the understanding that whatever was happening in that moment was going to complicate his afternoon significantly. He turned and left the ICU, moving faster than he'd entered, his phone already in his hand, his access to institutional power already flowing like electricity toward every network that might neutralize the woman standing over the general's open chest. The crash cart arrived at the general's bedside at 3:15 in the morning, wheels squeaking against polished tile like a death knell nobody wanted to hear. Sarah moved past it without breaking stride, her eyes fixed on Marcus Reeves, 4-star general, combat veteran, now a man whose chest rose and fell with the mechanical desperation of a body in its final act. The monitors sang their terrible chorus, blood pressure 48/22, oxygen saturation dropping toward single digits, heart rate climbing toward the ceiling as if trying to escape. She'd seen this before. Not in Cedar Creek Medical with its climate-controlled perfection and antiseptic walls. She'd seen it in the wreckage of a field hospital in Jolan District, Baghdad, 2019, where the only difference between living and dying was whether someone was willing to crack open a chest and put their hands on a beating heart. The attending nurse, Marcus Chen, no relation, was already drawing meds. 2 rounds of epi, Sarah said quietly. Not a request. Not dressed up in hospital hierarchy language. A command. Marcus didn't question it. He'd worked the night shift long enough to recognize the shift in her voice, the way her movements had changed from careful nurse to something with the terrifying fluid precision of apex predators. She was already gowning up, pulling on fresh gloves, her hands moving through the ritual with ceremony-ground efficiency. The general consensus downstairs had been unanimous. All 10 physicians had examined Marcus Reeves, assessed his aortic dissection, his age, his complicated medical history, and every single one of them had walked away. Age 78. Severe atherosclerosis. Ejection fraction barely functional. The textbook said no. The risk analysis said no. The liability committee would have said no if they'd been awake. Sarah had not been asked. She positioned the chest retractor with the kind of precision that comes from 100 field surgeries where hesitation meant your patient died on your hands. The crash cart was beside her now, defibrillator pads already attached to Reeves' pale chest, the rhythm strip showing a desperate electrical pattern that meant time was running out in exact seconds. She didn't count them anymore. Counting was for people who had options. She had one option, open. The scalpel moved through skin and muscle and fascia with the confidence of someone who understood that anatomy was a map and she'd memorized every street. Blood pooled in the open cavity, darker than it should have been, thicker, desperate. The hiss of air escaping as she spread the ribs, and then the pericardium, the thin sac holding his failing heart. Direct cardiac massage. Not the textbook external compressions that bounce on the chest like some kind of medical CPR. Real compressions. Her hand wrapped around the general's actual heart, beating against her palm like something small and terrified, and she squeezed it. Squeezed and released. Squeezed and released. Blood moving because she was moving it. Oxygen circulating because she was circulating it. This was physics now. This was hydraulics. This was a body understood as a machine and every component of that machine responding to the single question that mattered, who was going to keep it running? The monitors began to climb. O2 sat 58. 62, 68. The electrical rhythm on the strip was organizing itself, moving from chaos toward something resembling purpose. That's when Caldwell returned. He didn't walk through the ICU doors. He entered the way men with institutional power always entered crisis scenes, with the certainty that his presence would reorganize the room around his will. His phone was already in his hand, and the expression on his face was a map of someone who understood exactly what he was seeing, like a nurse, performing an emergency thoracotomy without authorization, without an attending surgeon standing over her, without the paperwork that made such things legal instead of prosecutable. Without waiting for the operating room. Without consulting the 10 physicians who had already said no. "What in God's name are you doing?" he said. Not a question. A recognition. A threat. Sarah's hand didn't stop moving. The general's heart beat against her palm. The monitors continued their upward climb. 71, 75. She didn't look at Caldwell. His heart stopped. "I restored perfusion." "Step away from that patient," Caldwell said. His voice had the tone of a man whose network was already mobilizing. She could hear it in the way he spoke, not the urgency of a physician facing a crisis, but the cold certainty of someone who had already picked up the phone before walking into the room. "Step away. Now." 2 security guards entered behind him, the kind of broad-shouldered institutional presence that hospitals employed for situations that fell outside the bounds of medicine and into the realm of liability management. They moved toward her with the slow deliberation of people following orders that felt uncomfortable but unquestionable. Their radios crackled. Someone downstairs had been called. Someone with authority was being summoned. The machinery of institutional power was responding to the threat of what Sarah was doing, saving a life that the institution had already decided was unsavable. The first guard said. His name tag read Mitchell. He'd been kind to her in the cafeteria once, back when she was new and still learning the social geography of Cedar Creek Medical. "We need you to step back." Sarah squeezed the general's heart one more time. Maintained the rhythm. The monitors showed 79. 82, his blood pressure was climbing. His oxygen saturation was moving toward something functional. She could feel the electrical activity reorganizing itself, the heart recognizing its own strength now that it had been given a chance to remember what strength felt like. She withdrew her hand. Blood coated her gloves to the elbows, dark red, nearly black in the fluorescent light. She stepped back with the kind of measured precision that came from discipline, not defeat. Her chest heaved once, but her face showed nothing. No trembling. No visible emotion. Just the careful compartmentalization of someone who understood that vulnerability was a luxury for people who weren't already bleeding out. Another nurse, Jennifer, from the day shift, called in early, took over compressions. She'd been trained. She performed external CPR the way the textbooks described it. Effective. Competent. But without the intuitive understanding of what a heart felt like when it was responding, when it was finding its rhythm again. The monitors began to drop almost immediately. 78, 75. 72. Caldwell's voice cut across the room like a blade. "I have the state medical board on the phone," he said. He held up his cell phone as if it were a talisman. "And a physician investigator from the licensing office. You're done here." Sarah removed her gloves. Placed them in the biohazard bin with mechanical precision. Her hands were steady. Every movement deliberate. The trembling would come later, in private, where it belonged. Right now, there was only the cold clarity of someone who understood that her mission parameters had just collapsed and there was nothing left but the protocols of extraction and survival. Caldwell followed her to the nurse's station, still on his phone, still orchestrating the machinery of institutional response with the certainty of a man who had spent decades understanding power. The morning shift was beginning to arrive. Word was spreading already through the back channels, the grapevine that moved faster than any official announcement. There had been a scene. The new night shift nurse had done something unauthorized. Something dangerous. Something that would require paperwork and investigation and probably lawyers. "Badge," Caldwell said. She would not be here when he woke up. That night, at 2:13 a.m., Sarah returned to the hospital laundry dock on the loading bay. The fluorescent lights buzzed overhead with the sound of 1,000 bees trapped in aluminum casings. The loading bay was empty, just the industrial washing machines and the smell of bleach and detergent rising like prayer from the concrete floor. She'd turned in her other scrubs weeks ago, but these, the pale blue set she'd worn during the night shift, the one she'd worn while holding the general's heart, these needed something different. She folded them with the precision of someone who had spent 23 years folding uniforms for inspection. Crease. Fold. Crease. Fold. Each movement deliberate, each angle exact. The fabric was thin now from 1,000 washings, soft in a way that new fabric never was. She folded them into a square, then a smaller square, each crease meeting its partner with mathematical precision. Her fingers trembled only when she wasn't paying attention to them. When she focused, when she brought the discipline that had kept her alive through 3 combat deployments, they steadied. The pale blue scrub sat on the intake counter like the shed skin of something that could no longer survive in its natural environment. She set them down, and it felt like taking off her own skin. The weight of mission failure crushed her more completely than any public humiliation, any clipboard thrown at her feet, any condescending dismissal had ever managed. The general's monitors had shown weak rhythm when she left, alive, barely, but without her hands continuing the compressions, without her understanding of what his heart needed, his chances had collapsed to something approaching negligible. The operation was compromised. The cover was blown. She'd been placed here to observe Caldwell, to document his fraud, to gather intelligence without detection. 2 years of work, 2 years of pretending to be someone smaller than she was, and in one moment of clarity, the moment when she decided that a man's life mattered more than her mission parameters, she had destroyed everything. She drove to the safe house in silence, the roads of Savannah empty at this hour, rain beginning to fall with the kind of persistence that suggested it might never stop. The safe house was a studio apartment on the edge of downtown, one of 100 anonymous units where intelligence operatives lived their temporary lives. She sat in the dark for an hour before accessing the secured line. 3 numbers in sequence. A pause. 2 more numbers. Another pause. And then the voice of her handler, someone she'd known only as Sullivan, someone whose face she'd never seen and probably never would. "Cover compromised," she said. Her voice was steady. "Trained. Operation failed. Awaiting extraction." "Explain," Sullivan said. She did. Without emotion. Without interpretation. Just the facts, the general's condition, the doctor's refusal, the decision point. Sullivan was silent for a long moment. "You made your choice," Sullivan said finally. "Yes, sir." Was he worth it? Sarah looked at the dark apartment around her, the life that was about to be erased, the mission that was about to be classified as failed, the identity that was about to be revealed. He was a 4-star general who carried wounded through hostile fire. "That's not an answer." "It's the only one I have, sir." Sullivan ended the connection. Sarah sat in the darkness for exactly 5 minutes and allowed herself to break. Just 5 minutes. The protocol was clear: compartmentalize, rebuild, prepare for extraction. She followed the protocol. Allowed the trembling to move through her body like a seizure, allowed the pressure behind her eyes to finally release, allowed herself the luxury of admitting that she'd made a choice that couldn't be unmade. Then she rebuilt. Brick by brick. Breath by breath. By the time 5 minutes had passed, the stoic mask was back in place, and Master Chief Petty Officer Sarah Chen was simply another night shift nurse waiting to see what the morning would bring. The morning brought truth in a way she never could have anticipated. The morning brought truth in a way Sarah never could have anticipated. At 8:17 a.m., the glass doors of Cedar Creek Medical slid open and federal healthcare fraud agents walked through carrying bankers' boxes like pallbearers carrying caskets. Behind them came state medical investigators, their badges catching the fluorescent light as they moved toward the administrative wing. The head agent, a woman with gray threading through her dark hair and the posture of someone who'd spent 20 years dismantling corruption, carried a single folder marked with Sarah's handwriting. 6 months of documentation. Every billing code inflation. Every kickback payment. Every patient complication buried in altered records. Caldwell was in his office when they arrived. The intercom crackled at 9:43 a.m. "Dr. Caldwell, please report to the administrative conference room." His voice on the hallway intercom was different now, tighter, smaller. The swagger had drained overnight. By the time the investigators laid out their evidence, his surgical empire had already begun to fracture like thin ice under spring thaw. 47 surgical procedures with inflated billing codes. Device supplier kickback payments totaling $283,000 across 18 months. 3 patients with buried complications, 1 had returned to the ICU, another had filed a complaint now suddenly relevant. Every notation Sarah had made in her meticulous chart reviews, cross-referenced with pharmacy records and supplier contracts, formed a web too intricate to deny. The press release came at 11 a.m. Cedar Creek Medical has suspended the medical privileges of Dr. Marcus Caldwell, Chief of Cardiothoracic Surgery, pending investigation into federal allegations of healthcare fraud and breach of fiduciary duty. The hospital's legal team had moved with surgical precision, 72 hours between federal agents walking through the doors and Caldwell's credentials being stripped like insignia from a uniform. The thoracic surgeon who'd been part of the 10-doctor refusal now sat in a federal interview room explaining that Caldwell had pressured the team to reject high-risk cases that might damage surgical success statistics. Each testimony compounded the next, each colleague distancing themselves like rats leaving a capsizing ship. Sarah watched the press conference from a safe house in Savannah's historic district, the walls painted the color of old bone. Her handler sat across from her, a retired Navy intelligence officer named Martinez with scar tissue visible at his jawline and eyes that had seen classified things he'd never speak aloud. On the television screen, FBI agents escorted Caldwell from Cedar Creek Medical in handcuffs, his suit rumpled, his wedding ring catching the camera flash. His face was the color of wet concrete. Mission successful, Martinez said quietly. The general was the priority. We needed someone inside who could protect him when the threat emerged. You did exactly what you were placed there to do. Sarah's hand moved to her pocket, finding the challenge coin, tarnished from 2 years of being carried, its edges worn smooth by the friction of her constant touching. The metal was warm from her body heat. She didn't respond. Cover was always expendable, Martinez continued. Compared to the general's life, your identity was a consumable asset. You protected him. That was the mission. I broke protocol, Sarah said. Her voice was different now, it had dropped an octave somewhere in the past 72 hours, the careful deferential tone of the night shift nurse burned away like flash paper. I revealed capability. I endangered operational security. You saved a decorated 4-star general's life. Martinez leaned back in his chair, the leather creaking like old ship wood. That supersedes protocol every single time. The Pentagon doesn't care how it happened. They care that it did. The retirement ceremony took place 3 weeks later at Naval Station Mayport in Jacksonville. Sarah stood at attention in dress blues while Admiral Harrison read her citations aloud, medals pinned to her chest one by one, the Bronze Star first, then the Silver Star with 2 gold stars indicating multiple awards, the Purple Hearts for Kandahar and Fallujah, and finally, the last and highest, the Navy Cross. Each medal was placed with deliberate care, the Admiral's hands moving with ceremonial precision. The audience erupted. General Reeves was there, fully mobile now, his chest scar visible only as a thin white line beneath his dress uniform. He saluted with the kind of respect that only comes between soldiers who've stood at the precipice together. But standing in that dress uniform surrounded by applause, Sarah felt hollow. The mission was complete. Her cover was burned. Her purpose was finished. She'd folded things with parade ground precision her entire adult life, uniforms, expectations, her own nature, and now there was nothing left to fold except emptiness. 2 years later, Sarah walked past a strip mall on Victory Drive in Savannah, the kind of commercial space where dreams went to die slowly. Through a dusty window, she saw him. Dr. Caldwell sat at a folding table beside a cardboard sign reading Supplemental Insurance Policies in hand-drawn letters. His suit was from a discount department store, the fabric slightly shiny in the way cheap synthetic blends become. No nameplate. No credentials displayed. Just a lonely man in a lonely space selling insurance policies to people who'd never heard his name. A coffee cup sat beside his stack of brochures, half full and cooling toward room temperature. Their eyes met through the glass for exactly 3 seconds. He looked away first. Sarah continued walking. The sound of her footsteps on the sidewalk was the only noise in that moment, a steady rhythm like a heartbeat that had learned to march. She didn't need to see his humiliation anymore. Humiliation was his permanent address now. Instead, she turned toward Cedar Creek Medical, where her official photograph hung in the main corridor beneath a brass plaque, a Master Chief Petty Officer Sarah Chen, USN, Guardian of Cedar Creek. She worked openly now, her rank and background public knowledge, training the next generation of emergency nurses in combat medicine techniques that had previously existed only in classified military contexts. General Reeves visited quarterly, always bringing challenge coins for her trauma simulation students, young women and men who studied under a legend they didn't fully comprehend until their first crisis, when her hands guided them through procedures with the kind of muscle memory precision that only came from having done it under fire. The retired Special Forces combat medic from Bed 3 had joined her staff. Together they ran the trauma simulation program, using real equipment, real scenarios, real consequences. The cafeteria where Caldwell had once knocked her tray to the floor had been renovated 2 years ago, but Sarah still moved through it with the same careful grace, never flinching when younger staff members whispered recognition as she passed. A young nurse approached her at the hospital's main desk during shift change, nervousness threading through her voice like sutures. "Master Chief? I heard what happened 2 years ago. When Dr. Caldwell, when he humiliated you in front of everyone. How did you not react? How did you not fight back? How did you just keep working like nothing happened?" Sarah considered the question, her fingers finding the tarnished challenge coin she still carried in her pocket. The metal had developed a patina now, the oxidation deepening its color like a photograph aging backward toward something more real than it had ever been. "A wise person once told me something I didn't understand at the time," she said, her voice carrying the kind of authority that came from having spent years saying hard things to people who needed to hear them. "True class is what you do when the lights go out. When no one's watching. When there's nothing in it for you." She paused, looking directly at the young nurse. "He needed an audience for his cruelty. I didn't need one for my dignity." The nurse nodded slowly, understanding settling across her face like recognition. Sarah walked toward the ICU, where the machines hummed their mechanical songs and monitors flickered with the vital signs of human beings caught between crisis and recovery. Her hands that had once been buried in a general's chest cavity while her entire world burned around her, while her identity collapsed and her mission exploded, now taught residents the same life-saving techniques she'd carried from Baghdad to Savannah. Steady hands. Sure hands. The trembling finally gone, replaced by something deeper, the kind of calm that only comes from having already survived the worst this world could offer and discovering you were still capable of grace when the moment demanded it. Behind her, in a strip mall 3 miles away, Dr. Caldwell sat alone at his folding table, watching people walk past without stopping, without recognizing him, without caring. And in Cedar Creek Medical, Master Chief Petty Officer Sarah Chen continued her work in the shadows where she'd always felt most at home, transforming quiet into strength, isolation into purpose, and the unseen into the unforgettable. If you made it this far, you understand that true strength isn't about being seen, it's about what you do when the world stops watching. Subscribe for more stories of hidden heroes, operators in plain sight, and the quiet ones who change everything. Hit that bell. Drop a comment telling us, would you have revealed your identity to save the patient, or would you have stayed dark? These stories prove that the best warriors among us often wear scrubs instead of combat boots.